Good morning, all my friends and my fans and my colleagues everywhere. This is Professor Dr. Tarek Ali. Today I will speak about an important issue in clinical practice which is confronted with at some times patients suffering from, and this might present either in the outpatient department, that's clinics, or in maybe even in the emergency room sometimes. This is the issue of what we call pseudomembranous colitis. Pseudomembranous colitis. Pseudomembranous colitis is a disease of the colon. It's an intestinal infection in which the intestine is colonized and overgrown by bacteria called Clostridium difficile, or sometimes recently we call it Clostridioides difficile. And this Clostridium difficile is an organism which is a bacillus and is responsible for producing of toxin which produces a sort of membrane, that's why we call it pseudomembrane, covering the mucosa of the colon, and produces a clinical picture of infectious enteritis. The pseudomembranous colitis, first let us talk about what is pseudomembranous colitis causes. Pseudomembranous colitis is the disease caused by the maluse and the overuse of antibiotics, especially the penicillins, the cephalosporins, the clindamycin, which is dalacin C, and the fluoroquinolones, and many other antibiotics also. But these are the four main groups which are caused, or which are causing the pseudomembranous colitis. When the patients consume such antibiotics, and this is one of the reasons why we should not abuse and overuse antibiotics and use antibiotics without medical supervision. This is a very big problem and an observable problem in clinical practice, that the public uses antibiotics or misuse antibiotics and they don't know that they might have side effects. And one of the most important side effects of antibiotics is diarrhea, the antibiotic-induced diarrhea. And more serious than the diarrhea, just the diarrhea, is the pseudomembranous colitis, that these antibiotics might cause a serious clinical issue, which is pseudomembranous colitis. So try, this is the advice and the important tip from this video is that we should not abuse antibiotics. We should not ingest antibiotics or eat antibiotics without medical supervision. We should ask our doctor, we should ask our physician, we should ask about any dangers or any risks from taking these antibiotics because of pseudomembranous colitis. Pseudomembranous colitis, which is caused by antibiotics, as I mentioned, it is caused by antibiotics and is treated by an antibiotic, as I will mention later on. The overuse of antibiotics will lead to the overgrowth. It will lead to overgrowth of the Clostridium difficile, which is toxin producing, and this Clostridium difficile will produce yellowish white plaques, which when they coalesce together they form a pseudomembrane over the mucosa of the colon. So it is a membrane covering the mucosa of the colon, and it first forms patches, and then these patches coalesce and forms pseudomembrane. This pseudomembranous colitis, it is dangerous because when it affects the colon and causing these pathological changes, it will lead to serious clinical manifestations, which may even be sometimes life-threatening. And these clinical manifestations are the most important is the watery diarrhea. There is a watery diarrhea which is more than 10 times per day. The stools are usually greenish or greenish yellow. It's accompanied by frequent crampy abdominal pains, lower abdominal, and then they become diffuse and radiate up to the abdomen and spread into the abdomen. So there is colicky pains, abdominal pains. There is also fever, there is nausea, there is change in appetite, there is loss of appetite. There might be also systemic complications due to the watery diarrhea. There might be dehydration, there might be hypotension, there might be fast heart rate, there might be also features of chills and the toxic appearance of the patient with the fever, as I mentioned, which is usually a low grade to high grade fever depending on the severity of the infection and the toxigenicity of the strain of the Clostridium difficile responsible for the infection in every individual patient. So this constellation of clinical symptoms, gut symptoms and systemic symptoms, mainly that watery diarrhea, the abdominal pain, the fever, the vomiting, the change in appetite, the hypotension, the dehydration, they are devastating. And if the Clostridium difficile enteritis or the pseudomembranous colitis not treated properly, it might be life-threatening. So it has high morbidity and high mortality. And it may even be complicated by sepsis. And this is the most dreadful issue and the deadliest issue in the pseudomembranous colitis, that septicemia might complicate in uncontrolled infections, and even it might be complicated by toxic megacolon, what we call toxic megacolon. There is paralysis of the colon. There is also may be complicated by colonic or intestinal perforation in rare cases. So perforation, toxic megacolon, septicemia, they are due to Clostridium difficile colitis, which is not properly controlled. So that's why this condition should be taken very seriously to avoid possible complications which may be drastic and threatening the life of the patient, especially, as I mentioned, the septicemia, the toxic megacolon, and the intestinal perforation. All of them are dangerous and risky and causing a high mortality. Identification of the condition and diagnosis of the condition after the clinical picture, which I just mentioned. By physical examination, there might be abdominal tenderness, there might be some rigidity in the abdomen, there might be also fever, low blood pressure, tachycardia, a toxic appearance of the patient, signs of dehydration if there is uncontrolled diarrhea without rehydration of the patient and without treatment of the patient for a long time. Signs of dehydration might be there. Even signs of hypovolemic shock might be there in neglected cases. So these are on physical examination. To reach the diagnosis by the laboratory, the most important is to take a stool or a fresh fecal sample and send it to the laboratory. All the tests are done on the stool exam or on the stool sample. So what is the test done? There are many tests which can be done on the stool specimen. These tests, the aim of the test is to detect the Clostridium difficile strain and or the toxin. There are many tests ranging from the immunosorbent assays, that is EIA test, which detect the toxin A and toxin B, and they can even detect the glutamate dehydrogenase. There are also real-time PCR for the toxigenic genes. These tests, they are variable in sensitivity and they are variable in selectivity, and they have might have false positive and false negative results. So the diagnosis, in fact, of Clostridium difficile, and the identification of the Clostridium difficile strain responsible and its toxin is not easy. It is rather difficult, and the interpretation of the tests used need accuracy and need diagnostic accuracy and re-evaluation and proper interpretation of the result of the test. For detection of positivity of the stool culture for Clostridium difficile strain antigen, and for the detection of the Clostridium difficile toxin responsible, because it's not only that the Clostridium difficile strain antigen will be positive by the PCR. It's important also to confirm that this strain is toxin producing and it is toxin positive. Because if it is antigen positive but toxin negative, most probably this organism which is detected in the culture is not maybe not responsible for the clinical condition of the patient if the toxin is negative. So to carry on test for confirmation of the strain antigen on one hand is important, and to confirm the presence of toxin on the other hand is also important, to prove and to confirm that the clinical condition is due to this organism. So stool culture is very important for detection of the Clostridium difficile strain and its toxigenic ability or its toxigenic character, that it is toxin producing. And the most sensitive and the most reliable test to use it in clinical practice is real-time PCR for toxigenic genes, as I mentioned, to detect and to identify and to confirm the CL difficile antigen toxin or toxin-producing antigen as the underlying cause of the clinical condition of the patient. So this is the diagnosis. So diagnostic accuracy is needed on the stool sample. In severe cases, we can also do similar tests on blood samples if there is a blood invasion, that is, if there is possibility of septicemia in neglected, advanced, severe cases, as I mentioned. So also other tests which can give you indirectly an idea is to do ESR. It will be high. Complete blood count usually reveals presence of leukocytosis. The white blood cell count will be high. There may be mild to moderate leukocytosis on full blood count evaluation. And in even severe cases with septicemia, there might be leukopenia or leukomoid reaction, depending on the severity of the condition and the type of organism and the type of toxin responsible for the clinical picture. Because as I mentioned, this organism produces different types of toxins, but the most common is toxin A and toxin B. There might be also other toxigenic strains of Clostridium difficile. So to look at the blood picture and the white blood cell count and to confirm the presence of leukocytosis in most of the cases and leukopenia in severe cases is a key to diagnosis of Clostridium difficile. But the most important is to detect the organism in the stool. As I mentioned, this is number one, and this is the most important for diagnosis of the cases. The treatment of Clostridium difficile colitis or pseudomembranous colitis is usually by using vancomycin, an antibiotic called vancomycin, and this is the most commonly used one. Usually we can give it as oral treatment, or sometimes in severe cases we give vancomycin enema. Also, we can give metronidazole if the vancomycin is cannot be found or is not tolerated by the patient. There is intolerance by the patient, there is side effects from vancomycin, or vancomycin is not available, so we can use metronidazole intravenously or orally. So vancomycin and metronidazole are the drugs which are commonly used for treatment of Clostridium difficile colitis or pseudomembranous colitis. In addition, of course, to treatment of the complications, we have to rehydrate. Pay attention to rehydration. We might give intravenous fluids, intravenous saline, intravenous dextrose saline, that is hemodynamic support of the patient, intravenous fluid resuscitation in dehydrated patients who have hemodynamic compromise, low blood pressure, high pulse rate. You have to give also antipyretics, antispasmodics to relieve the fever, to decrease the abdominal cramps. Once you give the vancomycin and the metronidazole, the diarrhea or the severe diarrhea, which is the most prominent symptom of pseudomembranous colitis, will decrease gradually and then disappear completely. This is the and it usually takes maybe from 10 days up to 2 weeks for the condition to resolve in most of mild to moderate cases. It takes 10 to 14 days after treatment that the pseudomembranous colitis will disappear, the pathological changes will resolve, and it goes back to normal. The pseudomembrane will disappear, etc. Rarely we had to do, or we have to do sometimes in rare cases, we have to resort to endoscopy like colonoscopy to see the membranes, and in some rare cases we might need to take a biopsy if needed, but in most of the cases, especially in the acute cases, we do not need such drastic measures. We might use it in intractable cases of colitis in order to differentiate this condition from other colonic pathological conditions or colonic disease, which might give overlapping clinical manifestations. So rarely we need endoscopy, and rarely we need ultrasonography for such cases, especially cases which are mild and acute. If chronic and protracted or resistant to treatment, we might need sonography, we might need also colonoscopy and other more specific tests, as I mentioned, in rare cases, colonoscopic biopsy. For differential diagnosis in cases with long-standing symptoms which do not respond to our primitive or primary medications given to the patient. So here, this is the issue of, in short, the issue of pseudomembranous colitis, and the message here is to avoid antibiotics. Antibiotics can cause this drastic colonic infection, this drastic colonic pathology, which might be threatening to the life of the patient and with high morbidity and high mortality, and this is what we call pseudomembranous colitis or Clostridium difficile colitis. Thank you so much and have a nice day. Professor Dr. Tarek.